Welcome. In this video, we will answer 5 pharmacological practice questions. I will also explain why we came up with the answer to better understand them. So without further ado, let's begin. Question number 1. The prolonged apnea is sometimes seen in patients who have undergone an operation in which succinylcholine was employed as a muscle relaxant has been shown to be due to A. Urinary atony. B. Depressed levels of plasma cholinesterase. C. A mutation in acetylcholinesterase. D. A mutation in the nicotinic receptor at the neuromuscular junction. Answer: B. Depressed levels of plasma cholinesterase. These patients have a genetic deficiency of the nonspecific plasma cholinesterase that is required for the termination of succinylcholine's action. Question number 2. The addition of glucuronic acid to a drug. A. Decreases its water solubility. B. Usually leads to inactivation of the drug. C. Is an example of a phase 1 reaction. D. Occurs at the same rate in adults and newborns. E. Involves cytochrome P450. Answer: B. Usually leads to inactivation of the drug. The addition of glucuronic acid prevents recognition of the drug by its receptor. Glucuronic acid is charged, and the drug conjugate has increased water solubility. Conjugation is a phase 2 reaction. Neonates are deficient in conjugating enzymes. Cytochrome P450 is involved in phase 1 reactions. Remember that reactions of drug metabolism have 2 general sets of reactions called phase 1 and phase 2. Phase 1 involves converting lipophilic molecules into more polar molecules and utilizing the P450 system, while phase 2 is the phase that consists of conjugation reactions. Question number 3. Which of the following results in a doubling of the steady-state concentration of a drug? A. Doubling the rate of infusion. B. Maintaining the rate of infusion but doubling the loading dose. C. Doubling the rate of infusion and doubling the concentration of the infused drug. D. Tripling the rate of infusion. E. Quadrupling the rate of infusion. Answer: A. Doubling the rate of infusion. The steady-state concentration of a drug is directly proportional to the infusion rate. Increasing the loading dose provides a transient increase in drug level, but the steady-state level remains unchanged. Doubling both the rate of infusion and the concentration of infused drugs leads to a 4-fold increase in the steady-state drug concentration. Tripling or quadrupling the rate of infusion leads to either a 3- or 4-fold increase in the steady-state drug concentration. Question number 4. Which one of the following is characteristic of parasympathetic stimulation? A. Decrease in intestinal motility. B. Inhibition of bronchial secretion. C. Contraction of sphincter muscle in the iris of the eye or meiosis. D. Contraction of the sphincter of the urinary bladder. E. Increase in heart rate. Answer: C. Contraction of sphincter muscle in the iris of the eye or meiosis. The parasympathetic nervous system is essential in maintenance activities such as digestion and waste removal. Thus, one will see increased intestinal motility to facilitate peristalsis, relaxation of urinary bladder sphincters to cause urination, and an increase in bronchial secretions. An increase in heart rate is a function of the sympathetic nervous system. Question number 5. The drug of choice for treating decreased salivation accompanying head and neck irradiation is A. Physostigmine. B. Scopolamine. C. Carbachol. D. Acetylcholine. E. Pilocarpine. Answer: E. Pilocarpine. Pilocarpine has proven to be beneficial in this situation. All the others except scopolamine are cholinergic agonists. However, their ability to stimulate salivation is less than that of pilocarpine, and their other effects are more troublesome.